Hello, and welcome to the channel Funfluence. Today we're diving into a topic that could potentially save your life and your finances, health insurance. Specifically, we're going to talk about how health insurance helps in emergencies. Whether you're dealing with a sudden illness, an accident, or any kind of health crisis, having the right coverage could be the difference between life and death, or at the very least, a financial disaster. So, stick around to find out why health insurance isn't just a good idea, but absolutely essential when it comes to emergencies. Let's start with the basics. What exactly is health insurance? Simply put, it's a contract between you and an insurance company where you pay a monthly premium, and in return, they cover part of your medical expenses. This can include doctor visits, hospital stays, surgeries, and even prescriptions. But where health insurance really shines is in emergency situations. Emergencies can happen at any time. You could be in a car accident, suffer from a sudden heart attack, or even fall victim to an unexpected illness like a stroke. In these critical moments, getting immediate medical attention is crucial. But what happens if you don't have insurance? Well, the costs can be absolutely overwhelming. The average cost of an emergency room visit can easily be thousands of dollars, and that's just for the initial treatment. Now, imagine you're facing a health emergency and you don't have health insurance. You're already stressed, and now you have to worry about mounting medical bills. This is where health insurance steps in. Health insurance covers a wide range of emergency services, including hospital stays, surgery, emergency room visits, and sometimes even ambulance rides. The best part? Most health insurance plans offer cashless hospitalization. Cashless hospitalization means that when you go to a hospital in the insurance provider's network, you don't need to pay up front. Instead, the insurance company settles the bill directly with the hospital. That's one less thing you need to worry about when you're in a health crisis. Emergency care also often includes things like diagnostic tests and medications that are vital for treating life-threatening conditions. Without health insurance, these expenses can add up quickly, making the situation even more stressful. But with the right coverage, these costs are taken care of. Another huge benefit of health insurance is critical illness coverage. Critical illnesses such as cancer, heart disease, or stroke often require prolonged treatment and can involve expensive procedures like chemotherapy, surgery, or extended hospital stays. Having health insurance with critical illness coverage can save you from a financial crisis. In fact, many health insurance plans provide a lump sum payout or regular reimbursements to help you cover treatment costs when you're diagnosed with a covered critical illness. This means that you can focus on your recovery, not on how you're going to afford your treatment. It's important to note that not all health insurance plans are created equal. Some plans may offer more extensive emergency coverage than others, so you need to make sure you choose the right plan. For example, emergency coverage should ideally include things like emergency room visits, surgery, hospital stays, ambulance services, and specialist consultations. Without these essential coverages, an emergency could leave you with significant out-of-pocket expenses. Health insurance is a safety net that gives you the confidence to deal with whatever life throws your way. It's like having a backup plan for when things go wrong, and it gives you peace of mind knowing that you're covered in times of crisis. Let me share a real-life example. A friend of mine was recently involved in a car accident. He was rushed to the hospital where he needed surgery. Luckily, he had health insurance that covered his emergency care. Not only was the surgery covered, but his post-operative care and rehabilitation were as well, all with minimal out-of-pocket expenses. If he hadn't had that coverage, the financial burden would have been enormous. This is a reminder of how vital health insurance can be in times of emergency. It can be the difference between a quick recovery and a financial nightmare. So, how do you choose the right health insurance plan for your needs? First, make sure the plan includes emergency coverage. Check for cashless hospitalization, coverage for ambulance services, and critical illness protection. You also want to consider the network of hospitals available under the insurance policy, as well as the claim settlement ratio of the insurance provider. Here's a quick checklist: cashless hospitalization, extensive network of hospitals, emergency and critical illness coverage, affordable premiums, and coverage options. Once you've reviewed your options, it's a good idea to speak with an insurance advisor to help you choose the plan that best suits your needs. In conclusion, health insurance is one of the most important investments you can make to protect yourself and your family from the unexpected financial burden of a health emergency. Whether it's an accident, a critical illness, or a sudden hospitalization, having the right coverage ensures that you can focus on getting better without the worry of overwhelming medical costs. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and hit the notification bell for more informative videos on financial security and health. If you have any questions or thoughts on health insurance, drop them in the comments below. I'd love to hear from you.